So you're dealing with a patient who has a forward head, and that's the type of forward head where you see some excessive backward bending in the upper cervical region. So that patient's eyes are above the horizontal. In effect, they look something like this. If a patient maintains this posture for too long a period of time, there's going to be shortening of some of the upper cervical soft tissue structures. The best way to address that is to use a belt or one of these therapeutic stretch out straps and place that strap around the C2 vertebrae. To do that and do that correctly, what we teach our patient is to compress the soft tissues around the bilateral lamina of C2, and that'll help to anchor those soft tissues. And at that point, they're going to do an active self-mobilization in the direction of flexion for their upper cervical region. They're going to use their flexor muscles to execute this particular self-stretch. And they'll apply cyclic loading until those tissues have stretched out and the patient is better able to position themselves with less upper cervical extension. So here's our patient. They look a little bit like this. We're going to take the belt, bring the top edge of the belt down below the occiput, bring it down an inch around C1, bring it down another inch or so around C2, and then we teach the patient to lift their chest up and forward and begin to gently bring their chin down and in toward their Adam's apple. With cyclic loading, this will stretch out posterior, upper cervical, soft tissues. This can be prescribed in sets of 6 to 10, 2 to 3 sets, whatever you feel it takes in order to get some degree of elongation of the posterior soft tissues in the upper cervical region.